good morning. This is Lakshmi, pharmacist, inspirational coach, and the creator of the parts alignment method. Today, I'll be talking about the allergy medication. Most of the times when I work at the pharmacy, lots of people come and ask me, hey, I have the itchy eyes or watery eyes, and I'm sniffling all the time, or I have the runny nose. What do you recommend? Can you tell me? I see like there are a lot of them available. I'm getting confused. Which one is the best one? Do I take the liquid, or do I take the gel capsules, or do I take the tablets? Why the prices are different? And which medication? I see like there are different medications. So which one do you want me to take? So I get all these questions too. Hopefully you get some answers if you are that person who goes to the pharmacy or to buy your allergy medications. So let's dive into it. There are not too many of them like you are seeing on there. Yes, of course there are many, but not the kinds, but there are different packages because it comes in 10 packages, 20 packages, 30, 50, 100, and also it comes in different dosage forms like tablets, capsules, liquids, gel capsules on top of it. So they're two different things, right? Everyone get confused. If I'm not a pharmacist, probably I might get confused too, because the way how the packages are, how they display on the OTC aisle can be very confusing and intimidating to select which one is the best for you. I hope this video helps you. Let's dive into it. What are the drowsy I'm talking about? Drowsy allergy medications are first generation antihistamines. Those are mainly available in US market especially is Benadryl or diphenhydramine. Benadryl is the brand name, diphenhydramine is the generic name. Another one is doxylamine or Unisum. So these two are the main first generation or drowsy antihistamines or allergy medications. Why we say these are first generation? Because this causes drowsiness and it's only used for short term. Let's dive into the Benadryl. Benadryl is the brand name of the diphenhydramine. It comes as a 25 milligrams, but you can take to 50 milligrams. That means you're taking it rather than one tablet or 25. If you want 50, you can take 2 tablets of it, 50 milligrams. The maximum dose for the day is 300 milligrams. So if you take like 50 milligrams, we recommend you to take like every 6 to 8 hours. The maximum you can take is 300 milligrams. So that's what it is. And it does come, like I mentioned, tablets, capsules, and the gel capsules form. And it does come in different package sizes as well. That's where the confusion comes when you come to Benadryl. Let's talk about the doxylamine now. Doxylamine comes is only 25 milligrams, which is Unisum. Most of the people take for sleep. Sometimes it might be combined with the pyridoxine or B6 vitamins for nausea and vomiting in pregnant women. But allergy medication or antihistamine, it can be used especially in the night times if you have very severe allergies. If you cannot sleep, doxylamine is another option than the Benadryl or diphenhydramine. So the maximum dose we recommend for the allergy medication is 25 milligrams for doxylamine as well, or Unisum. You might see that. So what's the problem or the side effects of these medications or the drowsy medications? Like we said, it causes drowsiness. That's why you don't recommend to take a longer time. You're supposed to take only short time, like 3 to 5 days or 7 days the max. That's it. You don't want to take more than 7 days. If you want to take a longer time, you have to take the second generation or non-drowsy allergy medications. I'll talk about that later. Let's talk about these drowsy or first generation antihistamines like doxylamine and the Benadryl, these two. Okay, what is the problems with these medications? Because if you have eye problems like glaucoma, you can't use this medication. Remember that if you have eye problems like glaucoma, it might get worse in your situation. So you don't want to take if you have glaucoma eye problem. Another one is if you're elderly person, the risk of falls is very greater. We say geriatric population. After 65, we consider as a geriatric population. So our geriatric population is not recommended because it has a risk of falls. And also it causes dry mouth, urinary retention and constipation, which is very common in the elderly population or geriatric population. Constipation and urinary retention. So be careful if you're taking these medications even for short term. Be careful about it. Make sure you talk to your pharmacist or you talk to your doctor in your area. So it is definitely recommended to speak to them. This video is only for your information, not for recommendation or suggestions, just giving the information. So follow through it. So like I said, these medications cannot be taken long term. It's only for short term and causes problems if you have the eye problems like glaucoma. Not to take if you're taking any opioids, pain medications, or if you're taking antidepressant or anti-anxiety medications, because on top of these opioids and anxiety medication cause drowsiness, taking on top of those medications, Benadryl can cause more severe drowsiness and sedation, which could be risk of falls or other problems. So be careful, and it's not recommended at all to be behind the wheels while you're taking this medication. And also, we recommend to avoid alcohol if you're taking these medications, because like I said, the medication itself causes drowsiness and sedation, and taking along with other recreational things like alcohol, or if you're taking with the opioids, anxiety, it only worsens it. So definitely not recommended. So that's about the first generation antihistamines, doxylamine and Benadryl. Let's talk about the non-drowsy antihistamines, or the second generation antihistamines. There are three kinds in it. One is fexofenadine, which is Allegra. Next one is loratadine or Claritin. Another one is cetirizine, which is Zyrtec. So let's talk about the fexofenadine or Allegra. It comes like 30 milligrams, 60 milligrams, and 180 milligrams. It comes in different dosages, like I said, tablets and the liquid, and also it comes in different packages. 12 tablets, 28 tablets, sometimes 60 tablets, 180 tablets, 120 tablets. It's different packages, so don't get intimidated. But the problem with the fexofenadine is you can take the maximum is 180 milligrams on it, but you have 30 and 60, so that's fine. You can take once a day, because these are very, it stays in your blood circulation for a very long time. So these medications are only suggested once a day, but Allegra can be taken twice a day because it comes in 30 and 60 milligrams also, depending on what dosage you're taking, up to maximum, but it's recommended 1 to twice daily. That's fine. But the problem with the Allegra is it does interact with the other medications. For example, if you're taking any antacid medications, we recommend you to take at least 2 hours before, 2 hours after you take your Allegra medication. Otherwise, it decreases the absorption of your medication. Which medication? Allegra. So the antacids interfere with your Allegra medication or fexofenadine and decreases its effectiveness. So even if you're taking if you take along with the medication, the allergy, you may not seem it's working for you. So you might feel it's not working, why I'm taking, right? But the problem is this, because you're taking your antacids with this medication, that's decreasing the effectiveness of the fexofenadine or Allegra. So don't take along with it. And also, if you're taking any fruit juices other than the water, any kind of fruit juices, orange, grape, any kind of fruit juices, if you take along with this one, you are also decreasing the absorption of this medication. So it is not recommended to take with any juices or any antacid medications. If you want to take it, take 2 hours before or 2 hours after, so that the medication works better for you. So that's the main thing with the Allegra. And also these medications, like all the non-drowsy or second generation, are eliminated by the kidney. So if you have any renal problem or kidney problem, these are not recommended, but depending on the severity, you might be able to use it, but it's up to your physician or your primary care provider. Talk to them and see what they would suggest you, and also you can talk to your pharmacist, local pharmacist, if it's recommended to take it. So let's dive into the next one, cetirizine. Cetirizine is Zyrtec, which comes as only 10 milligrams. It is usually once a day, but occasionally doctors do give twice a day, but it's only by the prescription. But if you're buying outside, it's only once a day cetirizine. So the similar way, you can the cetirizine doesn't have any reaction to any medication, so you don't have to worry about any drug interactions or food interactions. You can take it. no problem. But it is also eliminated by the kidney. So be careful if you have a liver disease or kidney disease, this is not recommended either. And the same thing with the Claritin or Loratadine, which it comes as a 10 milligrams. That's also mainly they give for once a day, but sometimes doctor do prescribe as a twice a day, which we don't recommend as a pharmacist unless doctor wants you to take twice a day. Our recommendation is going to be only once a day, but this is non-drowsy medication as well. Among all three, fexofenadine, Allegra and cetirizine, fexofenadine has less drowsiness, but sometimes with the cetirizine and Loratadine people might feel drowsy. So just pay attention to it, especially if you're taking long term. But only caution I said is, if you have the liver problems or kidney problems, you cannot take this medication. Make sure you talk to your doctor. Fexofenadine, if you're taking antacid medications, probably you might have to take 2 hours or 2 hours before, 2 hours after you take your juice or your antacid medications. Those are the main ones. And also these three medications almost come in the similar packages kind. I mean, like 10 tablets, 15 tablets, 20 tablets, or sometimes 120, 300 sometimes. I have seen the package of 300 quantity bottles too. But the price is also different too, depending on what size you're buying. And these are the dosage forms and maximum strengths we talked about. And most of the times cetirizine or Loratadine or Claritin or Allegra or fexofenadine, these are all comes in tablet forms and the liquid forms. And sometimes these come along with your pseudoephedrines. Usually you take for the cold and decongestant, it combined with it. And also it can combine with other medications like cough and cold medications. So be mindful about it. If you're taking any other cold medications, you're not duplicating the medication. That's very, very essential. Not to duplicate, not to indulge yourself with too much of taking the same medication, which can cause harm to you. And all the time, suggest you, look at the labels, look at the maximum dosage, what you can take, how much you have to take, how many times you can take. It specifically tells you on that label. Read it, take time, read it. And if you have any questions, all the time, walk to your pharmacy, talk to your pharmacist. If you go to the doctor, talk to them if you have any questions or concerns. But remember, the non-drowsy medications like Allegra, fexofenadine, Loratadine, or Claritin, you can take longer period, which is like more than 7 days. That's what I mean. Unless you have the annual allergies, you have to seek the doctor's help. And sometimes best way is to aware of what causing the allergies might help you. Sometimes you may not able to avoid the allergies, but sometimes you may able to, but you can notice what are the triggers that causing the allergies. But at the same time, like I said, pay attention to what you are using for short term or longer term, and what's your how old are you, depending on which medication is best for you, and what the side effects of the medications. That's very, very essential. And also, like I said, the labels does depict the information on it. Don't forget to read it. If you have any questions or concerns about this video, and like I said, this is only the information, please you can email me at inspireyou2526@gmail.com. If you want me to speak about any other medications that you're interested, let me know. And also on the coaching side, if you're interested or you want me to coach you, or if you want the videos on any part that you want me to talk about, please let me know. You can, if you like my video, please like it and subscribe and follow through my videos. Thank you again for watching. Have a great day, all of you.